talked to him over there about
And
it.
then the other
Well, I
one was
hope so.
with the NACO.
But I just
guy.
see me fishing
Right,
or something
yeah.
South
up here.
Oh, yeah, we'd rather you be fishing too. We'd like to be fishing with
I've
you.
done pretty good.
Schumer.
Have you?
Trying to
Of
get
course, I'm a catch and release guy.
this next round of going to counties and.
Right, well, I've seen that.
Catch and release.
Yeah,
Tom?
Bill, it was good to hear.
Tom, you ready?
Yeah.
Call the meeting of Crawford County Commission to order Tuesday, April 21st, 2020, begin with flag salute.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You bet. Wait for Tom, he needs glasses.
$3 a pair, you think that'd get it done?
Got a chance to look over the previous meeting minutes, is there any corrections?
I have none, and I will move to approve.
Second?
Aye. Moving on, signing the motions.
We had four motions from the last meeting. The first motion is 20-176, that the consent agenda be approved. Next motion is 20-177, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss non-elected personnel, to discuss the sign department, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 10:36 a.m. Next motion is 20-178, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss non-elected personnel, to discuss the sign department, and to include the Board of County Commissioners, County Councilor Jim Emerson, and Dale Shireman, and to reconvene by 10:47 a.m. And the last motion is 20-179, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss non-elected personnel, to discuss emergency management, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 10:53 a.m.
Thank you, Don.
Thank you, Donald.
Thank you, Commissioners.
All right. Yes, moving on, Rebecca, you have any updates for us?
We have no new cases, so that's a good thing.
Yes.
Yeah, so we've tested in Crawford County on the state map. It states like 318 or 320 yesterday. So we've tested over 300 people in Crawford County on the state website on the map. We have had the 6. The map says 4. The state map says 4. We had 4 positives confirmed, 2 presumptive positives. They were including those. I'm assuming that they aren't including those anymore for their reporting to the CDC. I haven't been told that specifically, but I have lots and lots of questions about that. We have had the 6 though, 1 death. Everyone's out of isolation. We had 1 person in the hospital. That person's doing better, is out of isolation. because they've met the criteria to be out of isolation now. So we have no family members in quarantine. We have probably 8 to 10 persons under investigation. That just means waiting test results. So they're at home in isolation, but not severely ill. We're just waiting on those results. So that's a lot fewer than we had before.
Okay.
So that's kind of where we stand with that.
I know, Rebecca, it's up to the governor, but I'm sure you're hearing it as well as my fellow commissioners. May 4th still look like that's
It's Sunday, May 3rd.
May 3rd.
At midnight, at midnight. So that's when things will open back up, will be on May 3rd. With the stay-at-home order. The
Okay.
stay-at-home order, I want to make sure I don't say this wrong. The stay-at-home order will expire on May 3rd. So we had talked last week about having a work session. I think that would be good.
Right.
So I don't know if do you want to do that this Friday, or do you want to do that next Tuesday? I haven't really gotten we have not received much guidance yet from the state on, like what the plans will be at the local level. They're working on some guidance to give out about that.
Do you think
so.
we'll know that information before
I'd like-
May 3rd?
I hope so. I know at the federal level, some guidance has already been put out by the president and his committee on how to reopen the country and some different things, but I would like guidance from the state on that, because every area is different, you know. We're not the same as New York or California. So I was thinking probably next Tuesday would be better. Just hopefully I could have that information or some sort of guidance from the state by then. I don't know when it will be.
So you're saying the 28th?
Like at 9. I don't know if we could do a work session Tuesday at 9.
We can do, yeah.
Sure.
And
Whenever
have-
works for your schedules.
Have emergency management there, and maybe Danny. Tuesday at 9. Will you be there? Okay. And Jim. But I'm just hopeful, and the commissioners, of course, I'm hopeful. I'll put that down then, Tuesday at 9, work session. I'm hopeful we'll have some sort of guidance to help us just kind of move forward with that. Because it's not recommended just to go back to business as usual.
Right.
That is one thing that's not recommended at any level. So, but we definitely don't want to restrict people more than we have to either. You know.
I think people just have to be smart and
Yeah.
understand
Common
that there's still a
sense.
threat. It's not.
Yes. Well,
it's
and there
not
is.
over, but
I'm on conference calls every day. I was just on one right when I came in here, and there's still a lot of talk about another surge happening in the fall. You know, that this is highly likely to come back in the fall. And then, you know, thinking ahead of what will we do if that happens, you know, how will we approach that, kind of like we had to in the beginning.
Right.
But we'll have more time to plan for it, so.
exactly. Do you see, or do you know what's going to happen? Missouri, Oklahoma. Is there talk yet?
I have not heard from any guidelines yet from Missouri or Oklahoma. I will say, though, Oklahoma is having a lot of cases, and so is Missouri. Missouri has quite a few more cases than Kansas. It's not necessarily near us, like in the Joplin area, in that area, it's not exploding there or anything,
Right.
but Oklahoma has a lot more restrictions. People are having to wear masks when they go
And they have like
anywhere.
60 in one nursing
Yeah,
home.
they have a lot, and that's not that far from us. But I have not heard anything about how they're going to be rolling out the new guidance. I'm sure everyone's going to continue with the social distancing, the 6 feet, you know, masks if you can. But I haven't heard anything about
We
them.
just need to think about that when we open
Yeah.
ours up, and if they're more restricted, that we're going to see traffic from those
Sure,
areas.
sure. Well, and I did receive an email from, I believe it was the Joplin City. Joplin, they have more than one health department there. They have a county health department and a city health department. And I believe it was the city health department administrator emailed myself and some others in the area. So we are starting to kind of go back and forth with some things that are happening. And so I'm hoping the next few weeks that we'll, and theirs may be totally different if they're having a lot more cases there than Kansas. Their governor may not rescind their orders, their
Right.
stay-at-home order when ours does, so yeah. It could get tricky down in an area where you're bordering along
Mhm.
other states,
Right.
but, you know, I mean, I did, on the call this morning, I have a call every weekday morning at 7:30 with both hospitals and community health. They just expressed, you know, whatever we do come up with, if we can just relay that out, I can do it, we can do it through the LEPC, get that out maybe a little bit in advance before, so I thought if we worked on it, you know, Tuesday, the 28th, that would give us some time to get it out to people and,
Kind of what it looks like in
Just,
our
like,
eyes,
be
but we
ready.
don't know
Right.
exactly what's gonna happen from the government.
no, no one does, yeah,
Right.
just kind of like, this is what we're thinking, if, as long as things stay calm and nothing goes awry, then
Okay.
kind of put a plan out there, what we'll do.
Right. Rusty, did you have something?
Just the element guidance, I was on conference call yesterday, and they advised me the governor has a team working on that right now. Hope to have that out, they thought by the end of the week or early next week before the third hit, so people can start planning accordingly. So just want to let you guys know on that as soon as I get it.
They have stated multiple times though that it will probably be up to, at the local level for us to put more orders forth. They'll give guidance as to, like, I'm hoping it'll actually be like scenarios, like if you haven't had this many, if you haven't had any cases in 2 weeks, this is what you should do. If you have active cases right now, this is what you should do, like recommendations specific to
Right.
maybe your level of
Mhm.
disease activity. But I don't know, I haven't heard that, I'm hopeful that that's what
That's
we'll
my
get.
guess, that they'll throw it back on the counties and.
Yeah, they
Of
pretty
course,
much
we can
said
always
that.
be more strict than the state is.
Right.
Right.
Just on that part.
Hmm. So we should hear something this week
I
then.
hope so, I hope by Friday, that's,
They're hoping by the end of the week, if not early next week. So
Okay.
hopefully before Tuesday before we meet.
yeah.
Good.
That'd be good.
All right.
I have also applied for the Kansas Health Foundation grant, it's $25,000. I don't know if I'll get it, of course. In my application, I'd like to do population testing to really see if we have more people in the county than we know of, but I'm just waiting to get.
Okay.
What scale would that $25,000 allow
Well, it would
for?
just depend on the testing, and two, also, the serum testing's not FDA approved yet, but they're working on it. There are serum tests available, they're not FDA approved yet, so it's not recommended to use them until they're FDA approved. You want them to be
Right.
specific to COVID-19, just not any coronavirus, like the cold, the common cold. So, some of the tests are $13 a person. So.
Oh, wow.
For the
So-
serum, for a finger stick, a rapid, so you can do a lot of tests with $25,000, you know.
Whereas you said the ones that they're using right now.
The
is
nasal
much more
swab is
expensive.
65, right, the nasopharyngeal, so it all will depend on, I really
You
don't
could
know.
get 5 or,
Right, now if it's an
one
actual
for that.
blood draw, that'll be a little more expensive as opposed to a finger stick, so, but I just want to have some sort of funding, because I know that it's been talked about at KDHE, funding's not really, there's not really any allotment right now for that, so I'm just trying to apply for things. If we can get something, we'll see.
have they indicated a timeline or turnaround?
No, and it's kind of like first come, first serve. I got my application in like the day after they put it out in the evening, the RFP, and I got it in the next morning, but I don't know how many did. And so there's no like real date they're gonna let you know. It's just gonna be like a rolling
Mhm.
grant cycle, whereas they get them in, they'll approve them, and when they run out of money, it'll be over.
Do you know
So-
how much money is available?
I was thinking it was 2 million or 1 point, I don't want to quote, but it was quite a bit. And the most you can apply for is 25,000, and that's what I applied
Right.
for, so.
Well,
Good.
We'll see.
hopefully that's what.
Yeah, I hope so. I would really like to do population testing because Crawford County is the largest county in southeast Kansas, and we're the 11th largest county in the state. So, I mean,
And they could do it by,
yeah, that is available, it's just not FDA approved yet. So
Right.
the problem with it is it can pick up the other coronaviruses, the human ones that we get anyways,
That we're not worried
that
about.
don't
necessarily
turn
right
into
now.
severe illness like COVID-19. So they're still just working on getting that FDA approved, but
As far as you said we had like roughly 320 tests that we've done so far.
Uh-huh.
What is that, how does that compare to like the state and nationally?
So
that
our-
testing rate?
And it changes every day, and when you go to their website, you can just hover over Crawford County, and it's, at the top it says testing rates. Ours is, I think, was like 8.9% yesterday, which is actually fairly high. There is one county that's like 19%, but they have a very small county and maybe have tested 50 people, so it looks super high, but we're right kind of at the same level as like Johnson County and Wyandotte County for
Per-
percentage of
per capita.
population. Yeah, per capita. So we've done, I feel like we're doing well. And of course, it hasn't all been done at the health department. Community health has really done a lot
Right.
of testing.
Sure.
So have the hospitals and other medical providers. I think Crawford has had a lot of just testing in general out there from multiple partners, and that's what it takes. One person can't do it all, so.
Right. And then, I mean, so are we entirely relying on the state for how to interpret that? Like what that testing rate and our infection rate means, or are we able to?
Right now, that's where our data is coming from. And so anything that, and the reason being is because this is a reportable disease. So regardless whether they're positive or not, all results go to the state. And it can be
Right.
an outside lab. It doesn't matter where the lab test was done. It could be Quest, RML, a doctor's office. It doesn't matter. So all of those, even negatives, are all reported to the state. And when you look
Right.
at their website, it shows how many have been done in the state, how many are positive. It shows how many have been done in a county if you hover over that county. And then, of course, we know how many we've had positive, and you can figure out like a positive percentage
Right.
rate from that. So yeah, at this point, and anything we would do, I would work with KDHE, whether we had to secure our own funding or not, so that if we do population testing, they'll help us run data and they'll help us with things like that.
I gotcha.
Yeah.
But then as far as interpreting, like, how do we respond to the rate that we have, like,
Yeah.
you know, how quickly we open things back up, that kind of thing?
Yeah,
That's-
you know, that's what I'm hoping we'll get, is some guidance from them. You know, there's guidance out there from the federal level, but I'm really hoping we can get some sort of guidance. And if we do population testing, you know, the whole point of that is to see if you have what's called herd immunity, which means you have so many people who've had it, they're immune to it, that the people who haven't had it are very low risk, so you could open things back up without limitation. That would be the goal of population testing,
Right.
just random, you know, you're not sick, we're just randomly testing to see if you have the antibodies that you've had this. That's why
So
you
it
want
would
an accurate
detect both
test.
people that currently have it, but also who had it previously but are better.
Right, right. And it would be a random sample.
Right.
You wouldn't specifically
Right, you're
pick-
not targeting people that have
Right,
been
it would
sick,
be a
yes.
random sample, so we would work with KDHE. I don't know, we could also work with Greenbush. They do all kinds of research and data stuff at Greenbush on how to collect random samples
Right.
from the county, inviting people to testing centers, you know. But it all hinges on if you have to have a reliable test, because if you have one that gives you an inaccurate positive that they really didn't have it, then you open everything up.
Right, the data's
So-
meaningless and potentially harmful.
Right, and that's why we can't do it yet, because we don't have that blood test that's really FDA approved yet. But I know they're working on it, and that would be my hope,
Right.
that we have money to do it once it comes out, that we're ready, but.
I was also talking yesterday with Sean Nacarado with PSU. He's
Mhm.
also the economic development coordinator for the city of Pittsburgh. And he was kind of interested, I think, in engaging the community and in putting together I don't know if a coalition is the right word, but just an inclusive discussion about what going forward reopening will look like in kind of partnership, certainly with,
Yeah.
I mean, us at the county and you specifically.
Yeah,
I think some of the concern was, you know, as it falls back into our lap away from, because in a lot of ways, the state made it easier, right? When they said, ours are the
Oh, yeah.
rules and you guys don't get to determine anymore, we get to go, thank goodness I don't have to
sure.
think about it, but it's going to most likely fall back on us on May the 4th. And so kind of his thinking, and I agree, is that in making those decisions, we want to have as many people in the room as possible that are going to be impacted by them,
Mhm.
local
Sure.
businesses and that kind of thing. So I mean, obviously relying on health
information. We don't want it to look like the National Committee to Reopen America that doesn't have any health officials on it, right? Like that is not the goal here. But to have voices from local businesses in the community and that kind of thing as part of that. So he had suggested even like doing a virtual town hall with like business owners or whatever.
Sure.
What's that gonna look like with the
Is he-
restrictions we have right now? 'Cause
Well, I mean, right.
the
with
Zoom method is not, I mean, it works in small groups, but it's not gonna
Yeah.
facilitate that
It'd
type
be
of
harder
group.
to, I mean,
Well, yeah, I mean, that would be the only way we would be able to do it right now before the 3rd.
And we don't know what she's gonna say.
We have no
Right,
idea,
or-
yeah.
right.
I mean, I feel like it's always important to listen to people and, you know, I mean, I want to hear what they have to say. I think that's important. It doesn't always change what we have to do sometimes.
Correct.
But I think it's important that people are heard, and I'm all for that. If do they want to set it up, or? does-
Sean sounded
does
like he would be
he
willing
want to set
because
something
they have
up?
some capacity, I think.
I would
to-
be happy to be on a call. I've done that with the, I already did that with the Pittsburgh Chamber of Commerce. We had a call, and businesses were on and asked a lot of questions, and really more they were wanting to make sure they were doing it right,
Right,
because they didn't want their employees to get sick. I mean, we don't want a situation like they're having in Southwest Kansas right now, where they have had a packing plant that has had over 50 cases, and now in that county, they have over 150 cases because they went home to their families. And
oh jeez.
and then on the call I was just on this morning with the Healthcare Coalition, there is a nursing home in Kansas. They did not say where. It's nowhere around here because I hadn't heard of it, but they had an employee that actually tested positive and kept going to work. And they've had
Oh, no.
24 deaths there, and
Wow.
over, I think it was like 150 cases there now. 12 or 15 people, something like that, in the hospital. I mean, so we don't want that to happen.
Correct.
Um, But yeah, I mean, and I think I can probably guess a lot of their concerns. I mean, it's just everybody
Sure.
has these concerns. But yeah, I mean, I'm willing to be on a call and listen and of course take all of those things into consideration. So
Well,
if
I
he wants
think-
to set it up, I'm good with that.
Okay, I mean, I think, like you said, we want this to be informed by health experts and
Sure.
the opinion of people that know virology and epidemiology,
Right.
right? But I think in having that inclusivity of like allowing people to feel like they're being heard is that you're gonna get more compliance and buy-in, rather than we came up with this thing, figure out what you're gonna do by tomorrow.
So I don't know if he can do that by Tuesday, because we're gonna be making we're gonna be working on this Tuesday.
That's why I'm wondering if we should almost facilitate a rough draft of what you think it looks like, and then have that discussion with them to
So
see,
maybe we should meet
see
Friday.
if they think that's completely out of reason or not.
Well,
'Cause
and
if you have-
two,
If you have too many people in the first conversation, I think it's going to be
Right, it'll be all
overwhelming.
over, you need something
Right.
to talk about.
so
Right.
maybe
Yeah.
Friday instead at 9, this Friday at 9?
Do you think that would be feasible?
I'm fine meeting Friday at 9, I just don't know that I'll have
The
anything
only
back
bad
from
thing
the
is whatever
state.
the state brings
Yeah.
out could
We may not have
completely
it by Friday.
change.
Yeah, and I
Right.
don't think it'll be hard to adjust. If things stay the way they are here, I hope, I don't think we're gonna have a lot of difficulty in coming up with,
Right.
6 foot apart, cleaning, all of the same things we were doing initially. I don't think we're gonna have a lot of trouble.
Right.
I mean, it could change. I mean, it could change in a day. We've talked about this before. We could get this all set up and then have
And then the
cases.
next day, the state does, yeah.
And then,
Yeah.
or they could have more cases in the state and they could extend their orders and what have you. But no,
Right.
the other thing I would just request that if he does set it up, that it be all of Crawford County, not just Pittsburgh.
Yes, right.
So, because there's a
Yes.
lot of businesses, that are in the smaller communities that I would like to see on the call as well. If
Absolutely.
he has a way to, I don't know how he reaches out to people, or if he goes through the chambers of Girard and.
I would presume that would be part of
Probably.
it, but yeah.
Yeah, and also to businesses that aren't in the chambers, I don't know how to invite those people, but I think there's a lot of businesses that aren't part of the
Right.
chamber.
Right, the chamber's not
I would just like to
necessarily-
see it be more inclusive than just a select few.
Sure.
I don't know if that needs to be put out on I don't know, on the radio or on a
Maybe
commercial
advertised,
or.
right, yeah.
And the thing too with Zoom, it would be much better, the problem with Zoom comes in is when you try to use it by webinar. If you call in to Zoom, there is not that problem. If everyone is on the telephone on Zoom, like we were just all on a Zoom call for Healthcare Coalition, but everyone is on the phone. There was a couple people on webinar and you could tell who was because they kept breaking up. So if everybody, and if he puts that out there, please call in, don't use the webinar, call in on the phone number, on the phone line. We won't have that problem with not being able to hear one another, so. But yeah, I mean, so if we want to meet Friday at 9 here for a work session instead of Tuesday,
If you think
I
that's,
mean, if you think
it's
that's,
fine with me, sure.
do you
I
think
mean,
we'll have the information at hand by then, or?
I have no, there's just no way for me to know.
that's, I mean, that's the,
Right.
That's the kicker on it.
Yeah,
I
yeah,
mean, what
because
will
we
we
can go
know?
through and,
yeah. I can ask more
Try to-
questions. We have a call every day at 3 with KDHE. You know, I can ask more questions.
Why don't we do that? Why don't you call Dawn, Thursday afternoon? And then if you have the
Okay.
pertinent information,
I'm just scared to go through and sit down and hash all this out, and then,
If something changes.
and then the state
Right,
gives us
right.
their guidelines, and it's
Sure.
completely
Or,
different.
I mean, I guess what we could do is meet Tuesday and then maybe Wednesday have the call with all the businesses.
That's
yeah,
doable.
Would that be better?
yeah.
Then we don't have to worry about
Maybe
switching it
something.
all up on everybody. It's
Right.
kind of nice to have it set. So let's just do Tuesday, next Tuesday at
Okay.
9, because that'll probably be the latest we could, whether we have anything or not, that'll be the latest probably that we should try to get something together.
Right, because it'll be that week.
Because it's gonna be that Sunday on Sunday, which I guess is the 4th, isn't it? Because it's 12 a.m., so you're
Right, yes.
right.
Yeah.
Okay, 11:59 or whatever, I don't know. But anyway, yeah, so the 4th, the morning of the 4th at 12 a.m., people will go back to, I mean, it'll end, so.
Right. Although ours is still in place.
Right, which I don't really think we want that.
Right,
I
we're gonna
mean,
wanna
if we don't
modify
have
it.
any cases between now and then, I don't think we want that.
Okay.
Ours is more restrictive than the state, you know,
So we need to rescind that before.
Well, and I think if we could do that like next Friday,
Okay.
rescind the old one and put
Okay.
whatever we come up with, put the new one in place. So it's ready to go Monday morning, on the 4th at 12:01. You know, then we'll have time to, you know, make sure people know what's going on but I don't think we should be more restrictive than, you
No.
know.
Right.
No, I think we
don't.
need to just figure out what the, and I hate to say
Right.
restrictions, but how restaurants are
Right.
going to adapt
Right,
and how.
Right.
yeah.
I mean, there's a very unique businesses there that have to figure out how they adapt, and then
Mm-hmm.
just make it known that the threat is not gone.
Exactly.
It's
Sure.
It's still there.
Sure.
And I don't know who I was talked to. My biggest concern is the 4th and stay-at-home order's over. Let's have a party. So and then just bring in a huge amount of chaos.
Right.
Right.
And I don't know who I was talking to, but wherever the first outbreak is in Crawford County, that business's name will be stamped to that. And it's sad, but and you don't want to have that
No.
on your
No.
conscience. So
And businesses really don't want that. you
right,
can
so
tell.
they just need to understand it's not kind
Yeah.
of like this 10 people doesn't mean you can't get it. It's just it lessens your
Exactly.
chances. So
Yeah, yeah. So
okay, so
Okay, so we'll
Tuesday
just-
the 28th, 9
we'll
a.m.
just do
work
9 a.m.
session.
Tuesday the 20th, and maybe he can set that up for Wednesday.
I'll
Call.
talk with them after
Okay.
the meeting today. And,
Um,
yeah.
Because I'm pretty open Wednesday. I always have a 3 o'clock call, so anytime after 8 o'clock, I'm pretty open on Wednesday. If he wants to do that. I think that would be fine, and then also that would be a good way to kind of discuss what we envision probably is going to happen in Crawford County. It hasn't maybe passed yet, but that's what we're looking at doing.
Yeah.
I would really like some guidance from KDHE on like beauty shops, barber shops. I mean, because they have to reopen. I mean, they are going to have
Right.
to reopen.
Right.
That's how they make money. And support their families, so they can't stay closed till we never have another case, because who knows how long that would be.
Right.
But I would like to see some guidance on that. Restaurants, I think, will be fairly straightforward. I think it'll go back to how we were initially, the tables 6 feet apart, at least for a week or two, a couple weeks would be good. So I
There's-
think,
Sorry. There's
no,
been
you're
some-
fine.
A couple restaurants right before this that had measures that were smart and how
Yeah.
to reduce the spread, cleaning not just the table, but taking everything off the table and always bringing it
Right.
back. I mean, there's certain things that are
Yeah.
simple that could
Which,
help.
gosh, during flu season, I'd like to see people do that all the time.
That'd be nice.
We'd have a lot less flu and stuff if everybody would do this. So, yeah, but there are just a few issues. I mean, and for pretty much, I think the factories and things in our area have done a good job because we have not seen that kind of outbreak in our factories. And we have quite a few.
Right.
You know, we have meat packing in Crawford County. We have a lot of industrial factories. And we just haven't seen that problem that some of the others have. So they must be doing something right. They must be following it. But I think the big one will be like beauty shops, barber shops, where you have to be in close contact with people, more so.
Right.
Do you see, now that's hard to predict this, but a way for us to, if we do see an increased traffic from out of state or even other counties north of us that may have greater restrictions, how we manage that?
Well, we can, I mean,
I know I'm just,
we can,
so we're all thinking about the same thing before
Right.
next
sure,
Tuesday.
the Board of
'cause that's-
Health and myself as the health officer, we can put quarantine orders in place from other counties. The state has not done that. From the beginning, they didn't recommend it just because, like Johnson County, a lot of people go to see their oncologist or
Right.
cardiologist, and you don't want to keep people from seeking necessary health care.
Restricting them.
Or Sedgwick County, a lot of people go to Wichita to the doctor, or Joplin to the
Right.
doctor. So, you know, I mean, other than getting the messaging out that continue this social distancing, I don't know how you would keep that from
That's fine, I'm
happening.
just thinking worst case scenarios.
Yeah, yeah, and I don't know that, because there were some more restrictive around us. You know, there was a fine, you know, in Lebec County, and I guess maybe it wasn't in place long enough for us to really experience any, you know what I mean, like
Right.
backlash from
Blowback
that.
or
Like,
something, right.
because shortly after the governor put her
Right.
stay-at-home order in place. So,
Right.
yeah.
Well, thank you.
Yeah.
Sheriff, you got anything to add?
I think the main thing, I mean, with Rebecca is just, the message is not to get complacent with this, that it's still a threat.
Right.
I think all the precautions and measures have been taken. If we're at 6, we're doing a pretty good job, and we need to keep that up. You know, my concern is that we get 7 in 1 week, Right. because we get complacent, and then, you know, we kind of start over here.
We're back
You
to
know,
square one.
It's concerning to me that you're starting to see reports from Johnson County and Wyandotte County that they're still seeing increases, and so, you know, I'm hoping that we don't have a lot of people going up to visit Kansas City right now. I know it's hard not to do that, but if they can still stay.
Say they're
here.
seeing a spike in their numbers?
It's still rising.
Yeah.
I don't know if they've actually, I don't know if their exact percentages, but they are still seeing new cases.
So, and that's what's tough throughout the whole state, is we're all seeing different things. So I think you're gonna see more of the populations like that, but I think it's important that we still send the message that we need you to refrain from visiting those places that are still seeing that and bringing that back here. So I don't know, you know, we're still doing our protocols at the jail. I don't want a cluster coming out of our facility. And so we're trying to protect the inmates. I'm trying to protect our first responders, because, I mean, they have a relationship that they're always around each other. So we're trying to keep everybody safe on that part, because, again, it could be, we could hit 6 or 7 in one thing. And I don't want to see that, and I definitely don't want to see it out of my facility. I think easing back into it and we have no idea what the governor is gonna do on that, but I agree. I think it would be tough trying to do anything from out of county stuff and force it. I mean, we have so many people coming through here. I know that we had one person that got arrested from another county, and then we got them bonded out really quickly and out of our facility because I don't want them here. But Otherwise, I think just the message to keep doing what everybody's doing and not get complacent, and let's just keep doing what we're doing and keep those numbers down and take care of our own here. So we'll just keep doing what we're doing. We'll have our work session and figure out how we're gonna get these businesses going
And I
it's
think
concerning for them.
Johnson County will probably remain more restrictive. Johnson and
Right.
Wyandotte, you know, I can't speak for them, but I imagine that they will have much more restrictive requirements than we would after the governor's order is expired. But-
Right.
And that's a little concerning. I think that maybe what her decisions might be based on those two counties that would continue here. I mean, and I know that's a lot of people's arguments is if you're out west or here,
Right.
you're not seeing this, why are we?
And I think that's why
Right.
they're putting it back on, at
Yeah.
the county level. I'm sure it is, because you can't,
Right.
that would just be like, you can't treat Kansas like New York or California or
Correct.
Washington. And that's why the federal government has not done that, because we're all so different. But, and if we get one case, we just need to remember, people will become very fearful again. And a lot of people will be like, okay, you need to clamp down. I mean, they
Right.
will.
Sure.
Even if you just get one case, because even we just had the first two, people really,
Well, that's what, I don't think everyone understands that because they're outside of some of it,
right.
is that there was a lot of people requesting that we shut things
Oh,
down
yeah, a lot.
before the governor made any decision
Mhm,
because they didn't think enough was happening. And now
exactly.
the fact that they want to open back up is really out of our control until May 3rd, whenever,
Right.
or 4th, whenever we decide what's going to happen from the
And I
governor.
think that's why a call is good, not only to just listen to other people's opinions, but also for us to be able to express our side, because
Yes.
when you're getting emails every day saying, you don't care if people die, I mean, you know, we
Right,
get
no,
it.
right.
You
Yep, I
know,
got them too,
I mean,
yep.
you have to do something, because
Yeah.
we do
Right.
care, and, I mean, then you get a little bit, more forward, and you're like, well, we do care, so this is what we're gonna do. You know, because you don't want a big thing like that nursing home that has all these
yeah.
people die.
Mhm.
But we have to remember, like Danny said, that even one case, it's gonna be like,
Right.
you know, so probably in our messaging, it would be important to put that, whatever we have, a call or whatever, that if we get a case, I mean, this could change, or if we get a couple cases.
Right. Well, it'd be nice to, I don't know if this is something we're gonna get from the state, but some kind of benchmarking of like, if you
A
go
trigger
for
point,
this
right.
amount of time with no cases, you can do
Yeah.
this, but if you get a case or so many cases, then you need like some guidance, so it's not the swing back and forth between everything should be open and why are we not under quarantine, like,
Well, and we've always wanted that, like, and in the beginning, we wanted that, like, how many does it take when you shut everything down?
right.
And that's never really been stated, and I don't look for it to be, but.
Mhm.
Is that something after the fact that we need to, the next time something happens, have a plan?
Because you gotta talk about,
I mean,
are we gonna be
I think we
proactive
have
or
to-
reactive?
I
mean,
think
I
there's
think we
bus-
need to have that in place
Yeah.
next
There's
time. So
businesses
it's-
already planning
yes.
for this to happen again and what it looks like for them. If they have to do
Sure.
just curbside or drive-through, they're going to accommodate that.
It's been trial and error for all of us.
But-
I mean,
Yeah.
really has.
So that, I think that's a more important conversation with everyone after the fact, all these
Right.
businesses, like what would have helped you to make a plan, because going forward, this probably will happen again.
Well,
Right.
and a lot to remember too is we don't know when we're gonna get a case, and I think that's what's frustrated people and businesses in the community the most is like, so we might get a case, so we would wanna put in our plan, if Crawford County gets a case, we will go to a more restrictive, plan, or if we could, I don't know,
Yeah.
I'll set a number, but a lot of it would determine where was that person at, like how many people were, maybe
Right.
no one was exposed to that person. So, to put in the plan, what we think we would do if we got a case would be good, and then people
Sure.
are kind of like, which we have no way to warn people
Right.
if we're gonna get a case, because it just happens
Right.
sporadically.
But if you
So-
can help shape expectations.
Right,
and-
so that they know, okay, well, if we get a case, then, you know, things are going to change. Put something in there like that. There's no way to know exactly when or how it'll happen, but I think that might help people just understand that it will change. If we start getting cases, we'll have to become more restrictive again.
Okay.
We'll know when the governor lets us know. I mean, you're kind of at the.
No, I
mercy of
know.
all
You're
that.
right, yeah.
In limbo till we
Yeah.
hear something.
Yeah.
But just clarify, I mean, some people don't understand that's the situation, that
Right.
No, they
it's,
don't.
it's
They're
not,
careful.
it's not us against them, we're just trying to figure
Right.
out
Navigate.
what happens next.
This might be a purely speculative exercise, but do you have any insight as to why the areas that have seen explosions in infection rates have and we have not?
Well, so the largest numbers are in Johnson and Wyandotte County and Sedgwick. Of course, it's just a population
Right.
issue. They have more people, and they have more people congregating. Some were in churches. Actually, I think 3 outbreaks were in churches.
Wow.
Yeah.
So that's obviously, anytime you're going to get a lot of people together, that's probably why they've had these things happen. The nursing home that had the person come to work sick with COVID-19, obviously. It's people who aren't following social distancing is what it looks like is happening. You know, if you're in a large plant and you're all working together and you have people who are sick that keep coming to work, they're not allowed to stay home. And that's another good thing to talk with employers about. Even though maybe we don't have cases, they need to still be working with their employees to stay home if they're not, even if they're just not feeling well. You know, maybe they don't have a high fever, maybe it's mild, they still need to stay home until they're better. So, in my opinion, it's because people are still going to work when they don't feel good, they're not social distancing. And in the big factories, I mean, obviously, if there's more people there closer together, it's gonna happen. So, I don't know for sure. There's no statistic out there that shows that our factories are doing anything different, but they must be. They must be doing something.
Doing something right.
They have to be, yeah, doing the cleaning and the distancing and letting people stay home when they're sick, and
Yeah.
they have to be, yeah. That's what I think, but this is my opinion. I don't know if it's the 3rd or the 4th and what time, but that's my opinion.
Thank you.
Thank you, Rebecca.
Randy, did you have anything to add? Did you have anything to add? That's fine. I didn't want to leave you out. Jessica, do you have anything to add on?
I know as far as our businesses are concerned, a lot of them are really starting to get nervous, and I think that the longer we are restricting like this, the more people you're going to start seeing breaking the rules here and there. I know even in Girard, we've got a couple people that, when they are completely out of income, they've been out for a full month already. I've already been hearing about a few people that are doing social distancing with some non-essential businesses because they can't compete with, say, Walmart or any of the other businesses that are allowed to stay open. And I think even if we do go ahead and make changes on the 3rd, on the 4th, we need to be able to allow the small businesses to get back open in some capacity.
Yep.
And not just.
Yeah, I think that's our
not
intention.
just the pickup.
Absolutely.
Yeah.
Because they're already struggling, and the more these people are stuck without any income whatsoever, the more you are gonna see people branching out and trying to just go behind what
Right.
we're asking them to do to survive.
Yeah.
Just financially, they're gonna have to.
Okay. And that's our intention. I think it's everybody's intention to try to figure out what that looks like, to get everything open, but at the same time, make sure that we're not going to increase the threat of someone getting it from them being open.
I've not got, we get the KEF and I get the emails and I send them to Danny and to Jim, but we haven't had a lot of no's on there. I'm not sure, and I know barber shops and beauty shops and things are closed, or pet grooming, but I haven't seen a lot of no's where people have to be absolutely closed. Are you seeing people that just kind of closed on their own?
People that are closing on their own because there's not a good way to maintain them. Some of the little retail shops that we
Yeah.
had in Pittsburgh
Right.
and in Girard, some of those
Right.
places,
Those,
they're
yeah.
doing what they can to take pictures and send,
Right.
and try
Yeah.
to post to try to keep, but they're losing
Like the
vendors.
boutiques
They're
and things.
losing, and
Yeah.
those are the businesses that they can barely compete with some of these bigger places
Right.
now, with everything going online. So if we want to be able to help and keep these people local and help keep these small businesses open, we're going to have to make some changes. But even if that means to allow them to have, you know, 5, 10 people in the store, depending on the size, instead of saying, you're not essential, you need to be.
No, I agree.
closed
That's-
unless it's curbside.
Well, and I think too, I mean, probably we won't be able to put necessarily a number to it. It would be something more like, as long as you can maintain 6 feet, maintain a 6 feet distance.
Right.
It's very hard because there's so many different size stores.
Sure.
Unless it's a big box store, I mean, you could be like, okay. no,
Yeah, the whole square footage thing doesn't matter when you have somebody that sneaks up right behind you.
Like 1,000 people could fit in there.
But no,
so
we,
it's fine.
that's, I think our intentions are to
Yeah.
look at opening things back up as soon as we have the authority
Right.
to, because right now we don't.
Right, we can't do much until whatever day. That's kind of confusing, isn't it?
Yeah,
I don't have it in front of me,
third and
but
fourth.
it's the night of the 3rd,
Yeah.
or the morning of the 4th, right?
So if there's any concerns,
It's been a long.
have them contact us or whatever. But I think what I'm hearing, beauty shops is beauty barber shop's a big one, the retail stores, but if there's other ones we're missing, we just need to make sure when we have that conversation, everyone's represented, which I think they should be, but
'Cause I
it's
mean, that's
complicated. We
really
may, I don't want to overlook someone just because I didn't think about it.
Right, yeah,
Yes.
so kind of in my mind, just to put it out there, I'm thinking like, you know, just like that, where it would be, you know, it's fine for people to be open as long as they can maintain the 6-foot distancing. I mean, that's just what I'm thinking. I haven't heard anything from KDHE yet, but kind of similar to what we did in the beginning, you know, about the 6-foot distancing.
Because
So
that's
they
what
can
we're hearing
operate.
now, is some of the smaller businesses are getting frustrated,
Sure.
because why can't they be open with 6 foot, since, you know, they're not essential, why can't they be open with 6 foot if Walmart is open with 6
Right.
foot? You know, these are the places that already have enough income to be able to
Sure.
survive, whereas the small businesses don't.
No,
Well,
I agree.
especially boutiques that sell clothes and things that have been deemed non-essential because they don't have the food products in there. So
Right.
it's not very fair, you know, in that respect.
And
Yeah.
that's what we're hearing from the businesses here,
Okay.
it's just, you know, they're struggling and need to get something.
I appreciate your input.
Yeah.
Thank you. Anyone else on the COVID-19?
I was wondering, I mean, as we try to think about the reopening and what that's gonna look like and the, you know, call or whatever, if we have like a document or something that has some of the guidelines we think will be in there, I mean, we might wanna put it out online, or I could email it to I mean, I have all the city clerks, the chamber people, stuff like that. We could email it out so they could look at it, and.
That's what I'm thinking. Tuesday, we try to put together, if we don't have any guidance from the state,
Right.
we try to put together what it looks like in our eyes and
And
put
then
that out
they
there for
could-
people
they
to
could
comment.
send Comments back to
Comment
me
back,
too.
and it's-
Trying to take comments over the phone from 50 different people can be pretty,
Well-
and that way we would be able to print them off and look at them and kind of.
What if we did it, we can talk about Tuesday, we can do a Survey Monkey too. And just
And
throw
I
a
think,
survey out
too,
there.
On the call, maybe, well, and I know every morning I have the call with the hospitals. They're wanting some way to communicate, so if he could invite the hospitals to this call, and it might be more of a one-way even conversation as to here's our plan, here's what we're thinking of doing, you know. What we do every day on the call with the state is you put the questions in the chat, they don't even have,
Right,
they don't even have to
that your
talk.
people aren't
They can
necessarily
just put it
calling.
in the chat, if we
Yeah.
can't get to them all, then, you know, we can respond by email later, and then we can also put out the email, for Dawn and that kind of thing, so that people are just aware. But I know the hospitals are really talking about how are they gonna reopen back to full services.
Mm.
It's not gonna be like all at once. Of course, right now, there can't be any visitors at Via Christi. Patients are
Right.
just in there, if they're not minors, they're in there without visitors or any family. They're not doing any elective or unnecessary surgeries that aren't emergent, so they've got a plan to start implementing some of those things back into place. But they really do want to know what we're gonna do as a county as a whole. So
Okay.
maybe if they could be on that call, that would solve that problem too. I mean, we have to have
Mhm.
multiple calls. One call would be,
Right, the fewer the
that would be
easier it
helpful.
would be,
Yeah.
right. Well, maybe, are you gonna be free later today? That we could set up talk to Sean?
Sure, yeah, you just call me and then you can patch him in or whatever.
Okay, yeah, we'll figure something out. Okay,
That's fine.
Cool.
Just text me maybe a minute or two beforehand.
Well, right, yeah.
Okay.
Hey, by the way, you're on the air.
Okay. Moving on. Anything else? Sir, you have anything to?
I didn't have my speech ahead of time. I'm sick
Okay.
of these dirt roads.
Okay.
It's not being maintained.
Well, they are being maintained.
Apparently you don't drive the same roads I do.
I drive a lot of them.
Apparently not.
So. But
All right, new business.
new business. Don, new business?
I don't really have anything. I did send you guys, a few I forwarded a few emails to you this morning that
Right.
I thought were very good. The one, goes that Hopper's report that, what they call the consensus revenue estimating committee at the state level had met yesterday, and they lowered their revenue estimates for the next year going forward. Basically, a lot of it sales tax, income tax, things like that. So they're talking about, putting a lot of the departments at the state level on kind of a notice that they really need to cut any kind of discretionary spending, any kind of raises, things like that, because although they have a pretty good balance in their funds right now, they're gonna be draining those probably over the next 6 months to a year. So, anyway, that's gonna be a problem for lots of governmental entities anyway. So, I just thought it was interesting, and you kind of get, a good perspective from what the governor was kind of putting forth, even though they didn't state anything specific. It was like, hey, you guys need to develop your plan of what you need to get by on, that might not necessarily be everything you want. So, anyway, I want to make sure you guys
Yep.
saw that.
Good information.
That's all I have.
That's it. Jim?
Yes, first I thought maybe we could, now that we have the sheriff here,
Do you have one?
Yeah.
I'll get to that in just a second. I thought we maybe revisit conversation about K7 now
Okay,
with
good.
the sheriff here.
Mhm.
And I know, I talked to the sheriff about this yesterday, told him that we were talking about it Friday, and I think he has some data that he was wanting to share. So if you want to go ahead and talk about that for a minute.
So obviously, that's been an issue ever since they've made the enhancements down on South 7 Highway. Essentially, what's really going on that we have seen and have got from some people from the state is that, and if you take your phone and you get the directions from Tulsa to Kansas City, it has them going through Girard.
Okay.
And so, if you're a trucker not from this area, and you're traveling from South 7 up here, then you get north of Girard, and like, oh man, this is not a good spot to be. And obviously, that's what we're finding out. So I've been compiling our own information because I wanted to send something up to the state also. But so far, we've had 9 semis on their sides or rolled over.
Oh my
up
gosh.
on so far, and that's just this year. I haven't even went backwards yet. And so, and I haven't even compiled the man hours that it's taken for those highways to be shut down. Because we've had times up there where we've got deputies up there for 6, 7, 8 hours. You have traffic, you have firemen up there doing that. A lot of times we get KDOT, they get up there and do a really good job of blocking the highways for us also. But there's just no room for error for the truckers once they get up there. If you have 2 of them that are passing each other, one moves over and drops a tire off, they're either sucked in from the ditch or they overcorrect and they roll. And 90% of the time, that's what happens, and that's what we've seen. Out of these 9, I've only got 1 that was a minor injury. So most of them, they're walking away. But you know what? What happens when we have somebody traveling the opposite direction that's not in the big truck and they get hit. So my main concern is the safety of the citizens that are traveling on 7 Highway. And I know a couple things we've talked about. We talked about that yesterday. I think we did too. Just from our stand, there's something that they can do at the state level to show that that's a narrow highway. So if they're following their GPS, those coordinates,
10-foot restricted.
it's showing that it's a narrow road, so we would direct them to go a different way.
Right.
I think that would take care a big chunk of the issue where these people that are traveling and the drivers have no idea what this road is like.
Until they're on
Sometimes I
it.
think they'd fall into the boat ramp if it led them that way, but they're just going by that, and it's deceiving.
Well, it's deceiving when you drive down this stretch.
Absolutely. If you're doing that
And
whole
you-
stretch and you get north of town,
Right.
that is not, and it's not even the curves. I mean, we have curves, we have hills, the grade variations. There's so many different factors in there, and a lot of times these are in the same spots within, a 1/10 of a mile to a couple of 100 yards of each other,
Well,
right?
you're getting ready to go into lake season as well.
Absolutely. So
That's just gonna increase the
It's-
traffic count.
it's not good for that. So if there's something at that level they could do that would deter the GPS coordinates a different way, that would be huge. But essentially, the only thing that's really going to fix this is get some enhancements on the north part too. And because there's just, like I said, there is no room for error. Even if you're in a car and you drop a tire off, and that's what most of our rollovers are. Somebody, they overcorrect and they roll. But we've been very, very lucky. Right now, all it's cost us is a lot of some property damage and a lot of man hours in terms of having to shut those highways down. And but I can tell you this: the last one that I went to the north side of the wreck, and there was no less than 25 semis southbound out of Fort Scott in that area that we had to turn around. And so the traffic is, you pay attention to it. We're seeing it's going both ways. And a lot of it, that's what they're doing, is they're following their GPS. So if there's some way that, like I said, I'm compiling my own information. This is just the 2020 stuff. I know there's a group up at the lake. I know Dave Goebel and those guys.
They've sent letters.
They've sent
We've
letters.
sent letters.
We've sent letters
So-
as well, yeah.
It just, like I said, I had 3 in January, 3 in March, 4 in March, and 2 in April. And some of these,
Wow.
1 day apart, 2 in 1 day, 3 days apart. I mean, people see it on our Facebook page, and it gets a ton of comments. A lot of them want us to do something about it, but I don't think a lot of people understand at the county level. I just can't shut a state highway down and say, sorry, we can't have trucks in here anymore. That's not, I can't do that, and you guys can't do that. So, but as a group, we can, reach out to the state and see if this is something. I know, I think it's Chautauqua County, I've talked to the troopers, they've got a similar incident going on with a stretch of their highway also, but a lot of it's passenger cars, and they are seeing fatalities. I do not want to see fatalities out of this, I really don't. So I think the one thing is, the reason I wanted to compile my own stats is because I think the state stats can be skewed a little bit, and I've talked to Bruce about this in the past, that if a semi just kind of gets sucked down in the ditch and he doesn't roll over and there's no report and he just gets pulled out, that stat does not go to the state.
Yeah,
They
it's
don't
not
see it.
counted, yeah, right.
And if
It's
they're
not
not
more
looking for those
$1,000.
stats, if they're not pulling up, they should be able to say, okay, between 47 and the county line, they could look that stats up, and it doesn't matter if we took the report or KHP took the report, but you have to be looking for it.
But it's a dollar amount, $1,000.
So yeah, you have any damage over that, or you have an injury.
Right.
But if it just goes in the ditch and gets pulled out, that's not
Doesn't
going to
get
be something
counted.
they're going to see. So that can be kind of like vehicle deer. There's a lot of vehicle deer stats that they don't see because we may have done a courtesy report, but we may do 100 of those. So that it's just those reportable things can not be completely accurate sometimes. So I just think as an entity as a whole, and like I said, I know there's different groups that are making efforts to do that. I think the GPS thing would probably be the quickest fix to do that. Like I said, I did it on my phone just to see, and sure as heck it brings you up through Girard and catching 69 the other way. So if there's some adjustment they can make, with the Google Maps or GPS or however they do that, I don't know who that's through.
Jim, do you have an idea how we can find that out?
There's two things that George Dockery said they're working on, and one is that 10-foot restriction.
Could that be signage?
I think it could be signage,
But
better
the
than-
GPS, I understand that, but also if you had, I mean, they still have an out at Gerard, they could cut over to 69. And they have an out at Fort Scott, if there's a sign there saying, don't go
Yes.
this way. And we're
Right.
talking about that stretch that really wouldn't detour them that far.
And I don't know what active God it would take to have a sign like that made. I know there's been times where
It
we use
wouldn't.
signs that.
As long as they read it, but yeah.
It would be tough to get, I'm thinking.
And then
I
you-
mean, I
and
think
then
it's
you
a
gotta-
great idea.
And then you gotta get the truckers to actually pay attention.
And-
Right.
Right.
But I think most of them are using GPS, so I think that
So
would be
they're-
your
that's-
quickest solution that I think you would see. I bet if you did a traffic counter here or did something.
Oh, it's
you
unreal.
would see a decrease immediately, or at least anything, they're gonna take 47. A lot of times, not 47's much wider, I mean, it's.
It's better.
It sees a lot more traffic, and it's a lot better. You have a couple stretches there, but, something definitely needs to be done. I mean, when we have something like that, it's hours. And like I said, late season, depends on how all this comes together, but you're.
Well, you get some old people in an RV meeting a semi, or 10 of them.
Well, I tell you this,
I mean-
one of the deputies, observed I guess it was probably a yacht type of vehicle. He was pulling this thing that was hanging off, 2 or 3 feet.
Oh my God.
If we have that vehicle in the hills meet a semi, they're both in the roads.
Game
He was
over,
able to
yeah.
get that vehicle, to go a different route. I mean, that's just,
Right.
that could have been a bad deal. I do not want to see any injuries or fatalities coming out of this.
Well, I appreciate you
Safety
putting the
is
time in.
number one. So, like I said, we're gonna keep compiling information, but I need to start drafting something, and I was gonna send something up and try to get that taken care of.
Thank you.
Cool, thanks.
Okay, I'm on the agenda for, actually, it's 2 items, but there's a certificate of substantial completion and change order number 5 regarding the Crockett County Sewer District 3 force main relocate. The certificate of substantial completion was showing that as of March 30th, substantial completion was met as attested to by our engineer, signed off by the contractor. And that's one of the documents. The other document basically is the change order to restart the timing on the project. As you know, we signed a change order, kind of waiting on that area to dry up so they could finish what they needed to do. And so they went ahead and let them start. They've got the tie-in finished, like we needed to get done to be substantially complete. So really, it's just a motion then to approve both documents, certificate of substantial completion and change order number 5.
Did they adjust for the change order for the fencing, or will that be done later?
That will be a separate change order.
Okay, because we're gonna get some money back off that, right?
Yes.
Okay. All right. Any other questions?
Mr. Chairman, if there's no further questions, I move we grant the substantial completion as well as change order number 5,
Second.
Aye.
authorizing the chair to sign.
How many you need, Jim?
3,
Couple?
please.
3?
I think I got number 4 in there as well.
It's close. Have you been up there and looked at it?
Yeah.
They got quite a bit of it cleaned up. I was surprised as wet as it was there.
It's actually, that whole project has went fairly smooth.
Yeah. Well, Mr. Ben Wicker, he's quite the guy. He's pretty easy to work with.
Really? Yeah. We got one.
Real easy to work with.
It was a good choice.
Yeah.
Okay, speaking of the sewer project, if you remember back several months ago, we had decided to request payment from the state. As we paid bills for the sewer district, we were gonna get reimbursed, and we thought at least for 1 year, out of our federal fund exchange money. That's still doable. What I thought we might wanna look at, and we have time to wait and see if this would be necessary, but as the state is seeing revenue shortages, I'm sure we're going to have our share as well. And it may be that we at least ask for reimbursement for the full amount. If it's not needed, we could funnel that back into Road and Bridge. So we could put it into the operating reserve. It's where these bills have come out. And then if things get back to where we're back open and we're getting some of the revenues that we're going to be losing kind of filtering back in, we may get to the end of the year and can move some of that back. So my recommendation would be that we ask for the full amount. I think that'd be 2 years' worth of federal fund money. And then year 2, we may be able to just move into Road and Bridge like we normally do. But it'd just be it'd be kind of a, I don't know what you'd say, a cushion that we could draw on if needed. And if not, you'd have it as you normally would.
Yeah, because we'll basically at the end of the month, we were just talking, in the month, we'll have a projection of what's the impact looks like as of right now.
Right.
And we'll have.
I don't think that'd be a bad idea, just
Right.
to play it safe, because worst case scenario, you turn around and you pay it off. Or-
We just.
I mean, that's a trade-off.
Right. We would just funnel it back into Road and Bridge. So, yeah, we'll have better numbers this month as we see what the sales tax is going to bring. We'll have even better numbers the next month with no casino revenue, revenue shortages for interest rates being almost at zero, and then sales tax being down. So, yeah, the next month or two, we'll be able to show what that's looking like. Hopefully, if we ramp things back up, those numbers will start getting on the positive side again. The final thing I wanted to mention, and this really we won't see this brought up officially until Friday, but speaking with Christy Mitchell and Randy Ryan, Christy said that Blue Cross has a couple of plans that we've had some employees show interest in. And I just want you to see this first, kind of take a look at it before Friday's meeting, and then Friday, there you go. And for Friday, I think Christy said that we could give her a call after we're finished with the normal coronavirus update. So I told her maybe around 10:30 we can call her and discuss what these plans are about. It's a cancer plan, and then it's a hospital indemnity plan. So it's something that they offer. We have other providers that offer similar plans. Randy said they're real competitive rates for employees. And we're obviously through Blue Cross, which employees can be sure has millions and millions of dollars in assets. So there's no issue with Blue Cross going under. So I think it'd be a pretty secure investment for the employees. So we're talking about that Friday, and that's all I have for good news.
Okay.
Yeah.
That's good. All right. Tom?
No, sir, I have no new business.
Jeremy?
I don't think I have any.
I do have one thing. Well, I think we need to probably bring in, I guess it's old business, after we look at the other revenue situations, bring in Randy again and just kind of get a solid plan and a number on some of the asphalt stuff.
Yes.
Because I've got what we budgeted this year versus what we spent last year, and then what we budgeted this year, just in case there is going to be some sort of shortfall there, just to make sure what's absolute priority if things take a turn for the worse. But
Yeah.
Doesn't have to be anytime necessarily soon. I just want you to think about that. And I haven't talked to Randy. It's just,
The season is.
it's here.
Close.
Right. I mean, they're doing it outside right now, so.
Yep.
Just to throw that in there. So that's kind of old business. Moving on to old business, Don,
I have none, sir.
Jim.
Just real quick, wanted to let you know that we do have the landfill back open
Yeah. I forgot about that.
for the free day customers and third-party pay. Worked well yesterday. I had a couple of calls about making sure that our person out there was kind of getting them funneled into the right place, but it worked out fine. Haven't had a call today, so hopefully that's still the case.
It's a good sign.
Yes, we've got the free day rules on our website, and the person out there is handing them out to anybody that doesn't have their loads tarped, that's bringing in burn barrels or things that aren't allowed. So we're getting some education out there. The tarped, untarped vehicles, we're keeping track of those. They're allowed to go ahead and dump at the site. We don't turn them away, but we are giving them the education piece. Then eventually, Danny's still here, we may want to do an enforcement couple hours at a time, kind of once we get that back open.
Okay.
So to let people know, the rules have been in place forever. Sometimes we get lax on, they get lax. They'd rather send somebody in if it's not too bad of a violation, just because we know if you turn them away, who knows where it ends up. So, but yeah, we may want to do at least some warning tickets eventually, once we've had time to get everybody through and give them the rules again, so they know what to expect. So yeah, it's opened up, it's going well, and that we will keep having an individual there until we decide what we're going to do with reopening the businesses after the governor's order ends. So just wanted to let you know that.
I guess that kind of brings to my mind about the casino. I haven't heard anything about that.
Right.
Have you? I haven't heard anything about it.
No.
I'm
Well,
sure
that's
it'll be however the governor's
State
hand down is
has-
interpreted, I'm assuming.
And the state has to kind of do that, don't they? Since
That's,
we're a state.
yes, the state has closed those
Yeah.
on their own, so I'm sure it'll be, once the governor decides what we're gonna do, May 3rd, then they will have to decide.
And
Maybe start-
that's another one that may be interesting if across the line they are closed
Yes,
and for some reason we
Yeah, I can
open.
see people coming
It'll be a
in for that.
magnet.
Yes.
Yeah.
oh, I'm sure,
Yeah.
yeah.
So that's a good point. I didn't. All right, Tom?
Business?
Yep.
No, I have none, sir.
Jeremy?
I guess this might have been under new business actually, but heading into budget season, I don't know if we're gonna have to modify how we go about it just because of revenue projection changes and that kind of thing.
Right.
What we want that whole process to look like, and if we need to be maybe starting to think about it sooner rather than later.
Probably a good idea.
It's coming on.
Yeah.
When do we usually start that, Jim, in June?
Or it may.
Yeah, usually we'll send out the, as we have sheets we generate out of our financial accounting software that'll, show to date this year, you know, what's happened as far as revenue and expenses. And we've tried to wait through the end of April, that way that gives us 4 full months of data as far as this year, and then it gives you the last, like, 3 years full of revenue and expenses, but send those out to, you know, departments and let them review them, then try to give them about a month to put in what they think they need or have to have for next year as far as their budget for those departments. And yeah, usually we're getting those in, right at the end of May, because it's basically May, the first week of May, we're sending those worksheets out to them. I might do maybe some preemptive communication to those folks to let them know those will be coming and be thinking about, you know, possibly a reduction in revenues next year. Our revenue streams may not be as big, and I'm sure, you know, as we get sales tax, we really haven't had, but maybe, I don't know that we've even had a full month of sales tax collection with
No, since
in the
the
new normal
closure
in
orders,
place. And so it's hard to really know how that's affected. There's a lot of places still doing business and collecting sales tax.
Right.
You know, maybe not as much, or some of them maybe more for a few days anyway, when people were kind of out doing their kind of initial buying, you know, and the shelves were, you know, empty at some of the stores. But, yeah, we'll have to try to figure out how that's gonna look for next year. You know, and that's, you know, maybe may involve a Ouija board and, you know, I don't know, how do you know? You have no way of
Right.
knowing on that stuff.
Right.
It's, I mean, you can listen to people who know more than us at the federal and state level and kind of maybe get some ideas there of what they think is gonna happen at the state level, that in our sales tax would probably follow, you know, state sales tax. But, you know, it's hard to get an idea on that, and, you know, luckily, we don't rely a lot on casino revenues for funding our budget. I mean,
Right.
it's nice to have, but it's not a big item, and we've always estimated it pretty low because we know it's not anything that's guaranteed, so.
Correct.
But we'll probably, you know, estimate it even lower now, because you don't want to have to rely on things that may or may not be there when you need them.
Right.
But yeah, I'll send out kind of a, like I said, a preemptive or whatever you want to call it, just to start thinking about budgeting coming up, think about next year, but also think about, you know, we may have to do what we do with a little less. So prioritize what's really you have to have, and there may be some things in there where they could give us a budget, their kind of bare bones budget, and then budget, you know, that they would like to see, you know, and we might be able to use both of those to kind of craft what we can.
Right.
But I'll start communicating with the department heads on that, so they're aware. I mean, it helps them start thinking about that sometimes. You know, like a lot of folks, until you've got to start thinking about it, you've got other things
Right.
that you're
Other
dealing
stuff
with,
on our
other fires to
plates.
put out, so.
Okay. Cool. Yeah, that sounds good. That is all I had.
Tax auction? I mean, I know we're waiting on normality here, but just to give people an idea what that looks like, is it going to be, do we have to repost all that now with the situation going, how it is?
I was
Since it's been
visiting
so
with,
long?
yeah, I was visiting with the judge, and she says that we will not have to repost, but I will still provide notice in the paper
That's fine.
more than once when we're able to get back open. I'm assuming June is when I'll be able to have a spot on the docket to have the sale, but I don't have a date yet. But I think I can get away without reposting the full lists like we did before, because we've already followed the rules, so the statute. I think I can just, I can refer to the online, it's online, post when the date is, run it 2 or 3 times, and we'll be ready to go, so.
Okay.
Cool.
And then what did you say about the landfill contract?
I haven't heard anything
anything
since
back?
I sent Thursday. We finally kind of came together on a final draft to send off. Haven't heard a thing, so.
Okay. I think that's all I had for old business. Okay, so future business, April 24th, 2020, 10 a.m. public hearing on closing and vacating an unnamed alley in the town of Opolis. Also on Tuesday, April 24th, a work session to discuss the ending of the governor's orders possibly and future activity in Crawford County.
24th through the 28th.
28th, sorry, did I say 24th? 28th.
28 at 9, yeah.
Yep. And then under announcements, courthouse will allow only limited public access through May 3rd. And offices are operating to assist the public by email and telephone. And we will know what that looks like after the 3rd, hopefully. Any other business to add?
Mr. Chairman, there's no further business, I'll move we adjourn.
Second.
All right. There's just so you
Thank
have
you.
it.
I'll talk to Sean and let you know, and we can set up a, I think,
Little, quite a bit.
right,
So that's
I
why-
think, like it could have gone less smooth.